If you're researching a TherapyNotes alternative for behavioral health, the reason is usually growth. Software that fits a solo practice today can stall your move into IOP or facility care tomorrow. Group practices outgrow solo clinician software the moment they plan an outpatient or IOP program, and switching mid-transition is the part nobody budgets for. TherapyNotes versus Behave Health, a comparison for group practices and treatment centers weighing where their EHR fits as they grow. This is for owners and operators who run a group practice now and have an eye on opening outpatient, IOP, PHP, or residential care later. TherapyNotes appears to be marketed at solo practitioners, with documentation, scheduling, and billing tools oriented around individual clinicians and one-on-one sessions. Its publicly listed features include telehealth support, clinical documentation, scheduling, electronic billing, payment processing, client portals, e-prescribing, and HIPAA-aligned messaging. It offers tiered pricing for solo, group, and enterprise accounts, a free 30-day trial, and reported discounts for 501c3 organizations. For current pricing, check the vendor's site. Each move into a new level of care is far easier if you don't have to rethink your software in the middle of the transition. When a group practice adds IOP, you become an institutional facility, and the professional CMS 1500 form you know stops being your go-to. Based on publicly available information as of April 2026, 3 areas appear to limit the fit for growth. Buyers should verify each before making a final decision. Where TherapyNotes appears centered on solo and small group practices, Behave Health was built to support practice growth, so the same software works before and after a transition to IOP. Behave Health supports UB04 facility claims, group notes, clinical collaboration, and integrated revenue cycle management between providers. The design is meant to let group practices open outpatient and IOP programs later, without changing software first. Based on publicly available information, 3 areas appear to limit TherapyNotes for group practices that plan to expand into IOP or facility-based care. Let's walk through them. These are the apparent gaps, the comparison flags. Verify each against your own growth plans before you decide. First, TherapyNotes does not appear to offer UB04 facility claim forms based on publicly available information. Group and solo practices bill professional services on the CMS 1500. When you add IOP, you become an institutional facility and often must submit UB04 forms instead. UB04 forms are essential for facility-based billing, and they may not be available if you choose TherapyNotes for an IOP or outpatient program. Second, TherapyNotes does not appear to include group note capabilities based on its documented feature set. Intensive outpatient programs often hinge on some form of group therapy, so group documentation is core to the model. If group notes are not supported, you may need to find another way to document and submit claims for those group services. Third, TherapyNotes appears to treat each patient record as a silo, designed around a single primary clinician. Each record appears structured to be created and modified by a single clinician, rather than for multi-provider collaboration. That can make the coordination of care, typical of an IOP setting, a challenge, where many clinicians touch the same patient. Common reasons group practices and treatment centers explore TherapyNotes alternatives cluster around facility-scale workflows. The comparison lays out. Needing UB04 facility claim submission, plus group TherapyNote workflows with attendance tracking, are the most common drivers cited. Collaborative, multi-provider clinical workflows are another, for teams that have outgrown a single clinician record structure. Others want a dedicated admissions CRM with lead tracking, or all-in-one operational tools like property and maintenance management in the same platform. Behave Health puts clinical, admissions, billing, and insurance authorizations in one app, designed to carry a practice across levels of care, rather than against switching software. The platform supports UB04 facility claims and group notes, the facility workflows a growing program needs. Revenue cycle management is integrated between providers with clinical and billing data in one all-in-one app. For current users, Behave Health provides a structured migration path, data migration, staff training, and parallel go-live support designed to protect your revenue cycle. Stop re-platforming every time you add a level of care. Book a 20-minute demo of UB404s, group notes, and collaboration at behavehealth.com. See UB04, facility claims, group notes, multi-provider workflows, and a structured migration path at behavehealth.com.